University.
Well, good afternoon, everybody, and friends and colleagues, and thank you so much for kind introduction, champ people. I'm going to talk about precision surgery. We now aware of precision medicine, but urologists should do both precision medicine and precision surgery. And this is my disclosure. So what is the innovation of surgery? I think there are three factors. Number one is precision. So and the number two is less invasive, of course, and also the third one is efficient training. And what is important is how to make a precision surgery. And because nowadays we have a multi-detector CT scan, this is not only the wealth of imaging, but also has so many digital data. And well, everybody recognizes this is a renal tumor in left kidney, but for the lay people, for your patient, doesn't really understand what's going on in the kidneys. But if you make this model out of the imaging that this is your kidney and this is your tumor, and we're going to take this out, it's very convincing, not only to us but also to the patient. So we're working with Japanese company Fujifilm, which has a technology to recognize a human face by AI. So we make the AI to understand the segmentation of renal anatomical structures such as artery, vein, urinary tract, tumor, and renal parenchyma. And by doing that, also we can manipulate. So for example, if we see this tumor, we can make a simulation for the partial nephrectomy. We call this virtual partial nephrectomy. And so this is operative field after removing the tumors, but you can overlay those imaging. Exactly, you can tell this is the artery, and this is the vein, this is the urinary tract, and so after the surgery. So this is imaging of a 3D segmentation, so what we call virtual partial nephrectomy, and this is actually the specimen which I did the surgery, so it's quite similar. And also not only imaging or simulation, but also you can calculate the if you remove the kidney renal parenchyma, how much you will lose renal function by calculating the blood supply area for individual branch of renal artery. So if you clamp this portion, maybe this portion of the kidney's function will be injured, but if you clamp here, much larger portion of the renal area, which is irrigated, it's perfused by this branch, will be lost. And actually, we published a paper that the predicted EGFR and the post-operative EGFR is a very good correlation by this calculation. So this 3D imaging is very good to have operative simulation. So I show you several data. This is a little bit bigger T2 tumors. And like this, and especially this 3D segmentation is powerful for doing renal hilum tumors. And also it's nice to show your patient that this is 3D model, and this is exactly the resected tumors. But also for surgeons, not only those model, because those vasculatures, and also you can take a look at from 360 degrees. So in the robotic surgery, you don't have a tactile sensation, and you cannot see from 360 degrees as open surgery. But by constructing this model, you can get a nice idea of how to do the surgery. So I'll show you some operative cases which has a relatively large renal tumor, and contralateral kidney has a little function. So we need to do partial nephrectomy for this patient. Because this case, the tumor invaded to the renal vein, we treated with the TKI for 6 months to make this tumor a little bit smaller. So this is a 3D segmentation model of renal tumors. And what is good to make this 3D segmentation model is you can incorporate into the Da Vinci machine by using Tile Pro. And still we cannot do an overlay of those images altogether. But usually that underneath the monitor, you can put this segmentation to tell where the artery branches and where the urinary tract. So for beginners of robotic surgery, it's rather safe to do the operation. So you can easily identify, so this would be a renal artery here, or the chances of open urinary collecting system. So those 3D segmentation construction is good to do surgical planning and also for image guidance. And for doing segmental clamping, selective clamping, so you can predict in advance that this portion of renal parenchyma will be making ischemic. So, and also for the training of partial nephrectomy, we constructed a training model using PVA. So you can make any kind of shape from a 3D printer, and it's good to both cutting, stitching. And the PVA, polyvinyl alcohol, is a type of synthetic resin, and also it could be used for food in the United States, so it's very safe. And this material has high hydrophilicity and also shape reproducibility, so you can make a shape of the patient by using a 3D printer. For example, you can plan to have this endophytic tumor, and you can try the ultrasonography here. So this is a tumor model, and also you can do operation, and also you can actually use cutting of Da Vinci machine. It's a little bit softer than usual kidney parenchyma, but it's if you want to train this, it's quite effective, and also cutting. And you can in advance to insert some renal artery here, like this. So you can make a training for clipping. And even you can make this is some dissection of artery model. And also it's a little bit softer than a real kidney, but it's good for training for renal and parenchyma sutures. So in Juntendo, that everyone who would like to do partial nephrectomy, first they try to do and minimize the time for cutting and also time for suturing. So probably I think maybe five cases is good enough to get learning curve. So if you're interested in this cutting model, please make a contact with me, and it's around 100 US dollars for each model. So 3D segmentation, simulation, and surgical navigation enhance the surgical precision, safety, and better communication with the patient. And robotic surgery really provides a good platform for the precision surgery. Thank you very much for your attention.
Any question for